Hey guys, welcome back to my channel. Today, I'm gonna share my entire skin journey with y'all. Grab a snack, a drink, some fuzzy socks, and get ready for this video because it may be a long one. So, tracing back to high school, I had pretty clear skin, no issues. I always took like an antibacterial pill to kind of keep down the acne since I was involved in sports. A lot of sweat would just cause clogged pores and I would get the occasional breakout. Nothing major, nothing scarring or anything like that. Moving on to college, I got engaged, we were planning our wedding, and all of a sudden my face just went bonkers. I started getting breakouts all over my face, mainly around my chin area, around my nose. I would get breakouts, and I just wasn't happy with the overall appearance of my skin. So before my wedding, I went to the dermatologist. We changed up a couple different medicines, got it figured out. So then to get my skin prepped for my wedding, I was doing microdermabrasion to resurface the skin, and I got a chemical peel. Now those things did help. My skin was perfect for my wedding. I couldn't have been more happy with it. Thank you, Jesus. It was such a long road and I was so scared that I was gonna have like awful looking skin on my wedding day, and that's not what any bride wants. So the more I stressed about it, the more breakouts I would get. So I found if I just forgot about it, I didn't pick my face, if I seen a pimple, I would just put the medicine on and move on. Let it heal and it would go away on its own. So then moving on to after our wedding, we decided that we wanted kids early on. So we started trying for kids after we got back from our honeymoon. And 2 months later, I was pregnant with our baby boy, Brooks. During pregnancy, you have to get off of all of your skincare regimen basically and start from scratch. So you basically just have to pray that you're gonna have the natural glow like everyone says you're going to, or you're stuck with horrible skin. So the first half of my pregnancy, I would say up until around 5 months, my skin was flawless. Literally, I had the glow, I had no breakouts whatsoever, my skin looked healthy, like I was so happy, you could just tell I was glowing. And then it came for revenge. So the last half of my pregnancy basically was horrible cystic acne filled. Ugh, it was so bad. The last half of my pregnancy was rough. I got cystic acne all over my cheeks, all over my jawline, all over my chest, my back, my arms, everywhere. Horrible. It got to the point to where it hurt to lay my head down on the pillow. It hurt to wash my face. I had really oily skin and it just was terrible. After I had Brooks, I thought, okay, my hormones are gonna level out. This is gonna be okay. Well, no, I was wrong. It got worse when I thought it couldn't get worse. So what I did was, after I had him, I was nursing for about a month. Once I stopped nursing, I went to the dermatologist. That's not why I stopped nursing, by the way. I'm sure I'm gonna get comments on that. But I went to the dermatologist to see what I could do to straighten my skin out, because at this point it was so far gone, and it wasn't even for looks, it was because it truly hurt my face. And so I went there and they suggested that I get put on Accutane. Now Accutane is a really harsh medicine. It basically dries your body from the inside out. It cleans it out completely. It goes in your pores and just wipes it all. So I agreed to do that, and I ended up on that for a month. So I took the Accutane for a month, and I think it was a God thing that I got off of it for insurance reasons. So we were gonna wait to the beginning of the year to get back on it. In the meantime, I switched birth controls, I switched a couple different medicines, and guess what? My acne went away. Yep. It wasn't any products that I was using. It wasn't anything that I was doing topically to my face that cured my acne. For me, it was all hormonal. All of it. The whole cystic acne awfulness was hormonal. And once I got my hormones leveled out, I was fine. And my skin was clear. To this day, my skin is still clear. And it's been clear for about 4 months. So It's such a breath of fresh air once you finally get rid of acne. Like, it's such a battle, it's such a struggle, it's like a game trying to get down to the bottom of it. Is it what I'm eating? Am I not drinking enough water? Am I intaking too much sugar? Am I using the wrong kind of makeup? Like, am I sleeping on a dirty pillow? I was washing my pillowcase a couple times a week thinking that it was dirty. Just all these different things. And it had nothing to do with what I was doing. I clean my makeup brushes, I'm hygienic with my products. So it's such a long, hard road, but once you finally get it figured out and you have clear skin and you start seeing results, it's like the best feeling in the world. So if you are out there struggling with cystic acne, I encourage you, try it all. Don't give up. You don't have to live with it. It is temporary. I believe that if you have horrible cystic acne, there's a good chance that it's hormonal. It could be from what you're eating. Change it out and see if it works. For me, I did that and it didn't help. I took out dairy in my diet. That didn't help. It had nothing to do with what I was doing. So don't give up. You can fix it. But in the meantime, I am going to share my skincare routine with y'all. So after I got rid of all of my acne, I was left with acne scarring. I was left with ice picket scarring and hyperpigmentation. So basically what that is it's red marks from where the acne was, where it's basically damaged your skin. With the cystic acne, it's so deep into your skin, and if you try to pinch it or pop it, it's going to pop under the skin and spread. It doesn't come to a head like normal pimples will. It just doesn't. So it spreads that bacteria and it just creates an entire mess. So literally my cheeks and my jawline was covered in the cystic acne. So I am left with the scarring, and I'm going to show you what I'm doing to get rid of it. So in the mornings, whenever I wake up, I go ahead and wash my face. I'm one of those that I have to physically wash my face to feel clean in the morning. So I start off with this Murad Essential C Cleanser. This is an environmental shield and it has the vitamin C in it. I think that everyone should have vitamin C in their skincare routine. This is a really gentle cleanser and I love it. Next thing that I'm doing is I put on clindamycin gel all over my face. If I have a breakout come up out of nowhere, if like it's that time of the month or whatever, I will use this Epiduo Forte gel. I will put a little bit of this on it. Don't pick it. I do not pick it at all. The next thing that I'm doing is I'm using a whitening gel. This one is from my local dermatologist. You can also use the Obagi brand. This is kind of a knockoff of that, but it's still really pricey. It's like $94, something like that. And it's just a clear gel. This is a bleaching gel, so you don't want to get it around your eyes. You just want to put it on all the other areas of your face. Before I do my makeup, I will put on my Cetaphil moisturizing lotion. That's all I do in the morning. Once a week, I will get rid of all of the little baby hairs that are on my face that could potentially cause like ingrown hairs or something, peach fuzz. It makes your makeup not look as smooth and fresh. I will take this little razor here. It's like a little electric razor and it turns on. And you can just gently like go over that peach fuzz and it'll take it right off. And you rinse it, put it back in, you're good to go. Smooth skin. Another thing that I will do once a week is I will use this Mario Badescu whitening mask, and I will specifically put it on the areas where my scarring is. Before I went to the dermatologist and was looking for answers for my pigmentation from the scarring, I found a couple different things. So when I was getting the microdermabrasion and the chemical peel from an esthetician, she recommended this face mask. So the brand is Image, and this is a resurfacing mask. It's from the Ageless line. And this is really gritty, and I would do this all over my face, like I would say once or twice a week. And this really changed my skin. It got rid of all of those extra like dead skin cells that just get stuck there. And it really made my skin smooth. So if your skin is a little bit acne prone, texture issues, try this. It will save your life. Another couple items from that brand that I used were this intense brightening exfoliating powder. So this is a dry powder, and you just put it in your hand, put it under water, and it'll create like suds. And then you'll put it all on your face and wash it off. This will brighten and whiten your face. So if you have any of those spots, any hyperpigmentation from acne scarring, this will help combat that. And another thing I will use at night, Intense Lightening Serum. And this is from the Image line as well. And I've had this forever. Those are things that I use on my own. So at night, I will do the exact same morning routine, but I will add my serum and I will add a thicker moisturizer instead of my Cetaphil one. So I will always put on my Rodan & Fields Multifunction Eye Cream, and then I will go in the rest of my face with this First Aid Beauty Ultra Repair Hydra Firm Sleeping Cream. And I just have a little sample bottle of this. It literally will last you a lifetime. Like, I have so many of these little samples. Here's another one. So there's a full bottle. When I wake up, my skin just feels plump and fresh and hydrated. So if you are still combating acne, you've tried everything and you don't know what else to do, get this Rodan & Fields Unblemish regimen. It is awesome. This really, really helped my skin, and it helped me clear up my acne before I got the cystic acne from hormones. So if you have bad acne, even if you have cystic acne and it's from other things like different toxins and chemicals, give this a try. It's, you know, it's a little pricey, but it works. It really, truly does. This is a morning and night system. The first step, they're all labeled. There's 4 steps. They have them labeled on there. So the first step is a sulfur wash, and this is an acne treatment wash. The next step is this toner. You just put on a cotton pad and dab it all over your face. The next step is this dual intensive acne treatment. You just get both pumps of this, put it in your hand, all over your face. And it also comes with a sunscreen. You want to make sure and wear sunscreen every day, especially if you are doing lightening treatments and getting really invasive on your skin. So this is the oil control lotion, and I swear by this stuff. It was the only thing that would help me with my oil. So to get all of that makeup off at night, I'll use my Garnier Micellar Water with these Whispers Premium Cotton Ovals. It's a great duo. It'll take me like 4 or 5 full cotton rounds to get rid of it all, but it really helps. Then to apply my cleanser and to wipe it off, I will use this makeup eraser towel. It's dirty. It's actually still wet right now. But I will use this to remove all of my makeup, and this will make my skin squeaky clean. Now, I don't know about you, but whenever your skin is sensitive and acne prone, I can't handle a harsh brush on my face. I break out even worse. I don't know what it is. My skin just can't handle it. But I still want that exfoliation, and I want to have a really smooth, clean, filling face. So this will remove everything. All you have to do is wet it and wipe it off. You don't even have to have product. It's crazy. This is like around $20, but I mean, I will use like sections of it, and then I'll throw it in the wash. So it'll last me a good 4 or 5 days. So this is such a good investment. If you don't want to get a brush that's like $150, get this. It works just as good, if not better. Works better for my skin type at least. So that is it for my skincare regimen. Now I'm going to talk to you about what I am doing to get rid of my acne scarring. So I don't know if y'all have heard about Fraxel laser treatment, but that's what I'm doing. I heard about it through my dermatologist. She recommended that I got this treatment done to smooth out my scarring on my face. Now this won't help with the pigmentation of my scars. Those will go away on their own, and this bleaching cream will help with that. but this will smooth out my skin. So they had a free consultation. I met with the nurse that does the Fraxel laser therapy, and we went over a full checklist, literally everything about Fraxel laser, A to Z. I mean, everything. So I thought I would share this with you guys in case you're wanting to get it done or you're curious to what it is. I'm going to share my entire journey with you guys. I'm going to show you my results. I'm being super vulnerable, but I know I wanted to see this whenever I was searching for people that have gotten it done before. So basically what Fraxel laser is, it is a laser skin treatment for treating aging, pigmented, and sun-damaged skin. So mine is pigmented and sun damaged. I mean, I have freckles all over my nose and under my eyes, but I'm not worried about those. It can treat wrinkles around your eyes, age and sunspots, melasma, skin resurfacing, acne scars, and surgical scars. So I have the acne scars, but if you have any of those other things, you can get this done to help combat that. So Fraxel laser treatments use pinpoint laser beams to treat thousands of microscopic areas of the skin. The laser beam penetrates beneath the skin surface to eliminate old damaged skin cells. The treatment stimulates the body's own natural healing process, which replaces damaged skin with fresh, glowing, healthy skin. You can do all areas of your body, face, arms, chest, back, anywhere. Due to the length of time it takes to start rebuilding collagen, full results from the Fraxel treatment may not be noticed for 6 to 9 months. So once the skin has fully reproduced and rehealed, that's when you'll see your full results. It takes time to build up your skin cells again. There is minimal downtime, which is generally known as social downtime. Patients can return to work the next day. I'm really curious to see how this is because I feel like I'm going to look crazy the next day. For optimal results, 4 to 6 treatments are recommended when treating wrinkles, surgical scars, and acne scars. So that's what I'm doing. But it only takes 1 to 2 treatments whenever you are treating any hyperpigmentation. So meaning freckles or like aging spots. Patients will receive a topical anesthetic 1 hour prior to procedure. So before your appointment, you need to go in and they will apply a numbing cream to your face. Patients of all skin types can benefit from and are candidates for Fraxel dual laser treatments. However, caution must be used when treating patients with a history of melasma. Patients with melasma should only be treated once yearly for that condition. Pregnant or nursing mothers are not candidates, obviously. They may cause fading of tattoos or permanent makeup. You just have to keep that in mind. So 2 weeks prior to your treatment, you have to stop all sort of microderm type products or like exfoliant products. So that surfacing mask, I can't do that anymore 2 weeks prior to that because you don't want to like over stimulate your skin. You have to avoid Juvederm injections to the treatment area for 2 weeks prior and 4 weeks after the Fraxel treatments. So if you get that's just like Botox or any type of filler. So these are some of the anticipated things that come with the treatment. So discomfort. All patients will feel some discomfort with this treatment. Patients will have tenderness that can last for weeks. Reddening. Laser treatments will cause reddening of the area. The reddening will go away in 1 to 2 weeks. Immediately after treatment, a patient will feel and look sunburned for approximately 4 to 24 hours. Swelling. Laser treatments will cause swelling, which will usually go away in 1 week or less. So what my nurse told me, since the swelling is pretty intense, she suggested that I sleeping propped up, so in a recliner or something like that, so the fluids can drain naturally from my face and it doesn't get so swollen that I'm miserable. So that's going to be fun. I don't know what's more miserable, being swollen or sleeping in a recliner. Those are the main things that are caused from the treatment. The rest of it's kind of like out there things, but they just want to make you aware they have to do that. So 2 weeks before, like I said, you have to stop all of your microderm, any kind of exfoliating products, but you also need to stop using Retin-A, Tazorac, other anti-aging products that contain retinols. They should also stop using glycolic or salicylic acid. If you have a history of cold sores, they will prescribe you Valtrex to be taken the day before. That way you don't have a chance of getting a breakout. Post-procedure instructions. Patients can wear makeup or shave the next day depending on the wavelength used. So with mine, she said I could wear makeup the next day. Not that I'm going to do that, but you can. Ice packs as needed for 10 minutes every hour for the next 24 hours for discomfort and swelling. Drink plenty of fluids to keep hydrated. Water and juice is best. Do not scrub the treatment for 24 hours or any cleansing brushes for 7 days. Wear sunscreen as well as moisturizer at all times. So make sure and just put that on, lather up in it, and live in it. Avoid using anti-aging products for 2 weeks after the treatment. Avoid petroleum-based products. Sleep elevated for a few nights if it's done on the face. So like my nurse said, to sleep in the chair, and use bleaching cream. It says to start the bleaching cream usually 7 to 10 days after your treatment. So before your treatment, each time your nurse will take pictures of your face and get a full look of before and after pictures of your treatment sessions. So that is Fraxel laser therapy in a nutshell. And so now I'm just going to show you a close-up of my face. I go tomorrow for the treatment. I'm so excited to see the results. I know it's going to be a long journey, but we are starting somewhere. So please don't judge. This is all from hormones. So thank you, womanhood, for this. But this is my skin before the treatments. You can see here, I have some really deep here, up here. This one right here is really deep. So that's what we are going to get rid of. And they did say that on some of the deeper areas, I may need to get some type of Juvederm or some type of filler just to raise it up a little bit more. That is my skincare journey. If you're still watching, thank you. I really appreciate it. I hope this helps someone else out. And if you're interested in getting Fraxel laser treatments, or if you just want to know more about it, then follow my series. I'm going to show you everything. Please subscribe to my channel if you are new. Comment down below if you had Fraxel laser therapy, or if you have acne scarring, anything that we covered in this video. If you have any questions, I'd be happy to answer them. Please give this video a big thumbs up. And as always, I'll see you next time. Bye guys.